I'm Alicia, one of the associate consultants in neonatology at KKH. So the first year of life can be quite stressful post-delivery, especially for first-time parents. So today what I'm going to do is just to speak to you on some of the common infant conditions that we see, so that you can anticipate them and also how to deal with them and when to seek medical attention. So firstly, I'll go through the newborn period, which is mostly the first month of life and what to expect, and then subsequently beyond the newborn period into the first year of life. So first, we'll look at feeding. So a common concern that a lot of parents have post-delivery would be, how much should my baby be feeding? So usually, actually, if you think about it, at day 1 of life, the baby's tummy is actually really small, maybe just the size of a cherry, and maybe by 1 week of life, about the size of an apricot. And by 2 weeks of life, it gets bigger, maybe the size of an egg. So they don't really need that much milk. So the first day of life, usually what we recommend is 60 ml per kilo per day. Day 2 of life, it goes up to 80. By day 5 and beyond, it will be 150 ml per kilo per day. And usually babies will feed at least every 3 hourly. So all this will be divided over a period of the whole day. And how you know your baby is getting enough would be looking at the urine output so that you know that baby is adequately hydrated. So usually for urine, we say in the first day of life, at least 1 wet diaper would mean that baby is getting adequate amounts to drink. And by day 2 of life, at least 2 wet diapers. And day 3 of life, at least 3. And after day 5 of life, baby should be getting at least 5 wet diapers per day. And if this, parents are always concerned about whether the breastfeeding is adequate enough. If baby is actually passing more than 5 wet diapers a day, then baby is actually getting adequate amounts of milk. And in terms of bowel output, what we look at is usually on day 1, at least once in the first 24 hours. And then subsequently, it's actually quite variable. So quite commonly for breastfed babies, because their gut is immature, so every time you feed, they poop. So you may get actually up to 8 to 10 poos a day. And this is actually normal, it's actually not diarrhea. And on the other extreme, there will be some breastfed babies that don't poo for like a whole week, and that is normal as well, as long as they're still passing soft stool. So now going on to the color of the poo. So usually in day 1, it's still very sticky meconium. So it'll be black color, and then slowly you'll see the color of the poo gradually changes to green, so dark green, then lighter green. And then by day 4 to 5, you'll get milk stool, which will be brown and yellow color. And this diaper here, which shows the pasty stool, is normal newborn stool. So this is not diarrhea. So quite commonly, first-time parents may think that this is diarrhea, but this is common. This is normal newborn stool. So what is abnormal would be no bowel output in the first 24 hours of life, because with this, we worry whether there's an obstruction in the gut. Other things that will be abnormal would be blood in the stool, and this is when you can seek medical advice as to whether what's going on with baby as well. So now we'll look at vomiting in babies. So vomiting in babies is common, but a common misconception will be sometimes parents also confuse regurgitation and vomiting. So when you go and see a doctor, usually they will ask, is it a true like projectile kind of vomiting, which we always say that is like a Malayan, large amounts. If it's just a bit of milk that spills after you feed or after you burp, then that's quite normal. So the most common cause of vomiting will be overfeeding. So parents often think that every time the baby cries, baby could possibly be hungry. So we tend to also just feed baby, and then baby will quiet down and maybe sleep for a while. However, this can lead to overfeeding, especially since the newborn's tummy is very small. And also and after that, when they lie down to sleep, what happens is because the muscle between their feeding pipe as well as their tummy isn't very strong, when they lie down, then if the tummy is very full, the milk then comes back out, and then they may then vomit as well. So try not to overfeed baby. Other things will be reflux as well. Things that can cause Things that worry us will be concerns for any cow's milk protein allergy. So with this, you may notice that every time you give formula, the baby may always vomit. Baby may get rashes when you introduce formula as well. There also may be blood in the stool. So this will be concerning for a cow's milk protein allergy. Other things would be when the baby vomits, it's green, like spinach color vomit. So this will be concerning for an obstruction in the gut, and definitely you have to bring baby to hospital to investigate. Other things will be with every feed, baby just keeps persistently vomiting and baby is very lethargic. There will be concern that baby may have a possible inborn error of metabolism where the baby isn't able to digest the milk as well. And this can be quite worrying as well. So things to look out for and things to bring the baby to hospital or to any medical practitioner for would be if there's any blood in the vomit, if it's dark green vomitus, if it's very forceful vomit, like Malayan kind of vomit, and also if baby is just really not gaining weight as well, because we want to see if there's any other further underlying issue. So as mentioned, reflux is common in babies and it usually starts around 6 to 8 weeks old and usually improves by the time they're around 6 months old, and that's because they're upright more often, they sit, and then therefore if they're not lying so much, the chance of the milk coming back up is not so much as well. And it is common for like when babies burp or when they feed, they may get a bit of milk that spills out, and especially with the burping. You will notice that often when the burp, as the air comes out, a bit of milk comes out, and that is normal, no cause for any concern as well. The main treatment for reflux is to really firstly ensure that you're not overfeeding baby. And if, let's say, some babies are more prone to reflux than others, what you can do is you try and split the feeds. So if, let's say, you're giving 30 mils, you can give 15 mils first, and then burp baby in between. After baby has a good burp, there's not so much air in the tummy, then you can feed the second half again, and you will actually notice that the chances of the baby bringing up anything would be a lot less. And if you're breastfeeding, what you can do is you can feed one side first, and then burp baby, and then after that, go on to feed the next side as well. Other things would be some babies just cannot deal with such large volumes of feeding every 3 hours, and you'll notice that they themselves will actually just want to feed every 2 hours and smaller amounts, and that's fine as well. So you can go with babies feeding cues, and you may find that they actually reflux a lot less with that. Other things would be after the feed to try and keep baby upright. So you can either carry baby on your shoulder, but of course to carry baby for 30 minutes may actually be it's quite long. So if you have cots that can elevate slightly, you can use that, or you can use the netted kind of bouncer, because those with a lot of padding, sometimes if baby moves to the side, there's a chance of suffocation. So this netted mesh kind, you can use that and keep baby upright for about 30 minutes post-feeds. And some parents will ask if there's any kind of medical treatment to just stop the reflux. So usually if baby's growth is otherwise okay, we usually recommend this kind of non-medical treatment, such as changing the feed volumes, feed timings. But if the growth is affected and baby is not putting up weight well because of the severe reflux, then subsequently we do come and seek medical attention, and sometimes we do start medication for these babies as well. So another concern a lot of parents have would be colic. So colic is something that usually starts when baby is a few weeks old, usually resolves once baby is about 3 months old. Parents always complain that babies will have this persistent crying, and whatever they do is very difficult to pacify baby. And actually, usually it resolves on its own, usually without any medical treatment. However, some parents do feel that by giving like Ridwin or Simethicone or even probiotics, they, in experience, it does help. However, there is no scientific evidence for it, although parents do feel that sometimes it does help. So if you feel that it does help your baby, then you can go ahead and use it. But sometimes actually the baby usually just grows out of this phase. Though it may be difficult, but if there's actually no sinister reason for it, most babies just grow out of it. So the next thing, common in the newborn period would be jaundice. So actually all babies get jaundice, but just to a different extent. So usually prior to discharge from hospital, we would usually check the jaundice levels and then subsequently tell you to go to the polyclinic. The importance of going to the polyclinic to check jaundice levels is that usually it will tend to increase, especially near day 5 of life. And we hope usually by 2 weeks of life, this resolves. However, you have to go for frequent checks to the polyclinic just so that we know where we are with the jaundice, and we don't want to miss any high jaundice that requires readmission for phototherapy. And this is because if high jaundice levels that are untreated can affect the brain, subsequently also affect development as well. So usually post-discharge, you can either go to the polyclinic or even a pediatrician to have your jaundice checked. We usually advise the day after discharge, and then subsequently, depending on your baby's level of the jaundice, then they will tell you to come back in a couple of days' time, 3 days' time, or sometimes even 1 week's time. Then, just a word of caution that some babies may need to be readmitted, so that's something you can be prepared for. Like if your baby's jaundice is quite high, the baby may actually be asked to be readmitted to hospital for jaundice, and this admission will be usually at least 24 hours. And risk factors for higher levels of jaundice would be if there's a blood group incompatibility between baby and mummy's blood group. If baby is premature, so even at 35 to 36 weeks, they're at higher risk of jaundice. If baby is feeding poorly, not passing enough urine, not passing enough stool, and especially if baby is dehydrated, there may be an increased risk of jaundice. If there's concern of infection as well, then this can also increase the chance of jaundice. If your baby has G6PD deficiency, then they are at increased risk of jaundice and readmissions for jaundice as well. This G6PD is usually screened at the cord blood, and usually before discharge, we'll let you know if your baby has G6PD deficiency and what precautions to take. If your baby does have G6PD deficiency, usually your baby will have to stay in hospital at least 72 hours prior to discharge. And this is just because G6PD babies have higher risk of having quite high jaundice, and sometimes at home, if you don't come back to polyclinic to monitor, this may then go to quite severe levels as well. So prolonged jaundice is usually in a term baby, jaundice lasting more than 14 days, and in a premature baby, jaundice lasting more than 21 days. So usually if your baby has prolonged jaundice, the polyclinic will then make a referral back to a tertiary center, so back to KK, and baby may need further evaluation. Most commonly, it is secondary to breast milk jaundice. But even though it's secondary to breast milk jaundice, there's no need to actually stop breastfeeding. You can continue breastfeeding as you usually do. And this kind of jaundice, once we do the test, so we will have to do some blood tests and urine tests for baby. And usually once we do the test and we tell you that it's breast milk jaundice, you continue with your breastfeeding, and we'll just continue to monitor the jaundice. This kind of jaundice is safe. It will not cross and affect baby's brain or development later on. However, if there's any cause of concern from the initial blood test that we do, then we will call you back, and sometimes you have to do things like even ultrasound as well. And things to look out for would be if there's any concern of any chalk-colored stools, so like white chalk-colored or white-grey chalk-colored stools, and any dark or tea-colored urine, then definitely seek attention earlier as well. So post-delivery, usually when we discharge, when babies go home, then the cord has not dropped off yet. So parents usually ask how to care for the cord. So I think the older generation last time, they used to use alcohol. So now usually we say there's no need to use alcohol. You can just use clean water and clean the cord. Then other things you can do would be to keep the diaper folded to below the level of the cord as well, so that it does not keep rubbing against the cord. And usually the cord will fall off by about 3 weeks of life. And if it has not, then do let the doctors in the polyclinic know when you go for checkup, or let your pediatrician know as well. When to seek any medical attention if there's very foul-smelling yellowish discharge that's coming from the cord, or there's very red skin around the cord and we are concerned about infection, then definitely bring baby for a medical assessment. So these are just some common conditions that you may see with the cord. So this is what we call umbilical granuloma. So with this, what you can do is you can bring baby to a pediatrician, and what we do is we use a silver nitrite stick to cauterize it. And this is because sometimes this can cause significant bleeding and discharge as well. Tonsillitis is infection of the cord. So as mentioned, you see this whole area is very red and inflamed, and then there's discharge, there's yellowish discharge from the cord. So do quickly bring baby to hospital, because what baby will need would be antibiotics, because these kind of infections can actually spread quite rapidly, can even spread to the blood, and baby can get quite sick with it. So now moving on to sleep in babies, which is a concern for a lot of parents, especially because it can be quite tiring, especially when babies don't sleep. So in general, the newborn period, some babies sleep most of the time, and actually their awake time is not much. So usually they will sleep for at least about 17 hours per day. And their day and wake cycles are not so clearly defined as when they are older as well. So they would usually nap. So usually what babies actually do, they will really wake up for feed and then post-feed sleep, and then wake up again for the next feed sleep. And that's quite normal. And as they get older, after the first month, they are awake more, and then you realize that you can have more playtime with them. And then by then, sometimes during the day, the naps may be less. And after about 6 weeks, the daytime sleep may actually start to get longer as well. And you would see that by about 6 months, the sleep, their hours that they sleep would actually lessen to about 15 hours. And then subsequently, by 12 months, about 14 hours. And then by about 18 months, about 12 to 13 hours as well. So sleep safety is also very important. So what we always advocate is a baby should always sleep in their own cot, and the first 6 months at least in the same room as mommy and daddy or as an adult, but the baby should always be in their own cot. And this is because, especially in the postpartum period when you're very tired, sometimes post-breastfeeding, sometimes you yourself may fall asleep as well. Baby may slip out of your arm, or you may actually accidentally roll over baby, and this can cause suffocation as well. So always ensure that baby is in their own cot, and baby's back should always be on the back of the cot. So baby should be always placed back to sleep. So don't place baby forward. Although I know that sometimes a lot of sometimes elderly may actually say, oh, place baby forward, they may actually have less reflux and they sleep better. However, there's always the risk of suffocation with that. So always put baby back. And other things to always ensure would be that the cot doesn't have anything in it. So no stuffed toys, no pillows, and even the padding as well. I know a lot of parents like to put the padding because you're afraid that baby will hit their head. But actually in the first few months of life, baby will not actually flip and hit the head. But don't put the padding there, because it can also there's the risk of suffocation with that also. Okay, and other things to do would be to also avoid smoking, or ensure that there's no one that smokes in the family as well, because this is also shown to increase the risk of sudden infant death syndrome as well. Okay, so now moving past the first month of life for baby, we'll look at feeding. So when to start solids. So the WHO recommends exclusive breastfeeding for the first 6 months of life, and subsequently after 6 months, then solids can gradually be introduced into baby's diet. And usually when you start solids, usually start with a single ingredient food, and then every 3 to 4 days, you can then introduce a new food. And usually why we recommend every 3 to 4 days is then you will know if baby has any allergies as well. Because if you introduce multiple foods at the same time, then you won't be sure which food baby could be possibly allergic to as well. Ensure all the food given to baby is actually thoroughly cooked as well, because their immune system is not as strong. So don't give any raw foods to them. Beware of any choking hazards. So ensure, especially when you first start, everything should be pureed. And things like peanuts should not be given to babies as well, because all these are choking hazard, or like large hard foods that they will not be able to swallow as well. And once baby is started on solids, then you can start some water as well. But prior to that, another thing is that a lot of elderly sometimes may actually tell you to give water to a baby because it helps with like heatiness, but this is not true, and it can actually be dangerous to baby because it can disrupt the electrolytes in the body as well. It can even result in things like seizures. So in the first 6 months, really all baby needs is actually milk, and baby doesn't need any additional water. Other things to note would be not to introduce fresh cow's milk before 12 months of age. And this is because these babies will not be able to digest this and can cause bleeding in the stool, and it's not good for baby's gut as well. So these are just some resources and ideas you can look at. So the HPB actually on the Health Hub, you can actually put in how old your baby is, and there's actually various recipes at different ages and what kind of food, and actually quite a nice guide as to how exactly you can start the solids and some ideas of what you can start with as well. And then the CDC also has one, and it also goes on to older children and how to some recipes as well of what you can do to feed your babies as well. So now moving on. So constipation is something else that's common in children. So children actually have a very varied stool frequency. It can range for baby to baby. And what is important to actually prevent constipation will be adequate fluid and fiber intake as well. So as mentioned, once babies start solids, you can start water also. Medication. So parents usually want medications to actually try and resolve the problem. So medications is really a short-term solution because the main thing would be try to modify the diet, ensure adequate water to actually help with the bowel output as well, because medications should be used as the last resort to solve the underlying issue. Parents may say, oh, the child doesn't like to eat vegetables and fruits. However, we should try to encourage them to do this because medications is not the long-term solution for it as well. So in terms of treating constipation, it's important for us to try and deal with it, because if a child is constipated for a prolonged period of time, this can have some adverse effects such as increased risk of urinary tract infections, and it also can affect the child's toileting habits as well, especially when they get older. A lot of times the stool becomes very, very big and becomes hard to pass and painful as well. Then the child associates passing stool as a very scary and painful process, and then they try to withhold the stool as well. So usually early solution and early trying to change the diet, ensure the adequate fluid and good diet would actually help to prevent it from getting to this stage as well. So bring your child to actually seek medical attention if there's significant blood in the stool or there's significant abdominal pain as well. So diarrhea is also something that children may actually have a common infection in childhood, and this is just a frequent passage of watery stool. Sometimes there may be tummy pain, and the tummy pain is usually just before the stool is passed, vomiting, fever, and what we call gastroenteritis or stomach flu as well. Usually this lasts for about 2 to 4 days, and usually self-limiting, don't need any particular medications for it, but it can sometimes last up to 10 days as well. Usually the cause is a viral infection, but sometimes it can be due to significant allergies as well. The main treatment for this will be to ensure that your child is well hydrated. So what you can do, especially if there's vomiting, is to ensure that baby or your child has small frequent feeding, because if you feed a lot, they may end up vomiting, and this will make the child dehydrated quite quickly as well. So just give small frequent feeds. If the child doesn't want solids, then that's fine, because the main thing to prevent dehydration would be to ensure adequate fluid intake. So what you can do is to give oral rehydration solution. You can even buy this over the counter at the pharmacy as well, and not to just give pure plain water, because when the baby is losing through vomiting as well as diarrhea, they lose the body's electrolytes as well. So what you can do is you can give oral rehydration solution, and this will replace the hydration as well as the electrolytes adequately as well. If the child is vomiting so much that he really cannot retain anything, or having so much diarrhea that the child is so lethargic as well, significant tummy pain, severe tummy pain, significant blood in the stools, then do bring your child to see a doctor as well. Sometimes the child may need an IV drip and hydration for a couple of days till he's feeling better as well. The main prevention for this, often they will say that, oh, there's another older sibling with the same symptoms of diarrhea and vomiting. So it can pass very quickly within families as well. So main thing is to ensure good hand hygiene, especially when taking care of between children as well. And if you have a baby as well, because babies can get dehydrated very quickly. Other things you can do would be to ensure that your child has the rotavirus vaccination, because this is actually the most common cause of diarrhea in children, especially once they go into school. So the next thing we'll look at would be fever in children. So fever in children wise would be temperature of more than 38 degrees. Usually in the first 6 months, we'll say to use the axillary thermometer, not the forehead or the ear one. It's not so accurate. And then subsequently, you can then go on to using the ear thermometer. So usually fever would be that of more than 38 degrees. Usually it's secondary to a viral infection. Usually flu, gastroenteritis, other things can sometimes be a pneumonia or a urinary tract infection as well. Usually the fever medicines that we give, like paracetamol or Brufen, only help to keep the child more comfortable, but it doesn't change the cause of the illness. So parents will say, oh, but I keep giving the medicine, but the fever is not coming down. So the fever medicine just really helps to keep them more comfortable, but the main thing will be the cause of the illness. And if it's a viral illness, it will usually run its own course, and you don't need any antibiotics to treat this. In infants, however, less than 3 months, fever is a serious sign of infection, so do bring the child to hospital. In older children, we'll usually say to seek medical attention if fever is more than 41 degrees, the child is lethargic with difficulty in breathing, there's dehydration, or there's a prolonged fever of more than 5 days. So some common misconceptions about fever. So high fever does not cause brain damage, unlike what people say, unless if it's secondary to meningitis. So if there's infection of the lining of the brain, then this can then cause neurological problems next time. However, in general, high fever does not cause brain damage. Children need antibiotics when they have fever, so this is a common misconception as well. However, a lot of times it's just a viral infection and they do not need any antibiotics. The next one is that fever is a medical emergency. So unless it's a neonate or infant less than 3 months, or your child is immunocompromised, fever is not a medical emergency. It is a sign that yes, the child is having an ongoing infection. However, the cause may still be a viral infection. The other common misconception is that high fevers will always cause seizures, and this is not true. So fevers can be associated with seizures. However, not all high fevers will cause seizures. So other common infections that children may get would be cough. So this is common. It can be secondary to viral illnesses most commonly, sometimes pneumonia, bronchiolitis, or allergic rhinitis even. So to consult a doctor if there's persistent cough of more than 1 week, if the child is very breathless, there's persistent fever, wheezing, coughing persistently associated with feeding. There's no need for any over-the-counter medication. A lot of times parents want a medication to actually suppress the cough, but there's actually no need for that. In fact, some of the medication can even cause drowsiness. And actually, another thing to note is a lot of times parents struggle with medications a lot because a lot of children just don't like to take medications. So all these viral illnesses may actually run their course on their own. So there's no need to struggle. If the child is otherwise well in between, no need to struggle with the medications. So urinary tract infection is another common thing that's seen. So usually presents with persistent fever without a source with foul-smelling urine. So bring your child to the emergency department or pediatrician to do a urine test to look for evidence of a urinary tract infection, and this is usually treated with antibiotics as well. So these are just some common rashes. So this is erythema toxicum. It's a red rash, sometimes can even look quite angry, commonly seen. There's nothing special you need to do. Doesn't cause baby doesn't feel uncomfortable by this as well, and usually it will go away on its own. Neonatal acne as well, no particular treatment needed. And diaper rash also, this is commonly seen in infants. You can just use a zinc oxide cream for this. Okay, cradle cap, also commonly seen in infants. You can just use olive oil for this. Okay, and eczema. So for simple eczema, you can just use moisturizers for this at least twice a day. If you feel it's getting worse, you can see a doctor for a mild steroid cream also. So I won't go through the development part because I think there's another talk on development. Childhood vaccinations wise, this is our Singapore schedule. So it's very important to get your children vaccinated. This will protect themselves and also when to go to school, other children and also your family. So it's important to attend all your child's childhood immunizations. So I'll just quickly go through infant safety before I end. So just always ensure that all small objects is taken away from a child and never leave them unattended as well. Never leave them even in a bath unattended as can drown. Keep all hot objects out of reach of children. Ensure that the child has no access to any medications or household cleaning products and electrical points also. And always remember that a child should always be placed in an infant car seat and not carried in arms as well. A rear-facing car seat is recommended in the first 2 years of life. This is very important. And in terms of screen time, avoid screen time less than 18 months old. And this screen time can be harmful, can cause behavioral issues, can also affect their academic performance and development, also affect their sleep as well, and affect their social development. So that's all I have for now. So thank you very much for listening.